Sean Carroll is my name. I'm a plastic and hand surgeon working here at St Vincent's University Hospital, Dublin. I've been working here for the last 14 years or thereabouts, and I run the hand surgery service in Vincent's Hospital and the hand surgery clinic. We see a lot of varied type of hand problems and hand injuries, to include osteoarthritis, which is the thing that we are now currently developing a treatment for. The treatment of osteoarthritis of the thumb has always been quite difficult. The early stages of treatment have been conservative and not really all that effective. The surgical treatment has always had to wait until such time as the patient gets really, really bad and painful, and then the operation is not an operation that you rehab from very quickly. So there hasn't been a really good treatment of early stage osteoarthritis, and the possibility that this trial is going to help patients with early stage osteoarthritis then hopefully modulate the disease or stop the disease continuing in the way it has been, so that it doesn't reach an end stage, is very, very exciting. A lot of the patients who come to me looking for treatments such as this will have had steroid injections into their joints. While the thing that we're doing now is a little bit more than that, it's certainly not all that much different, and I would imagine that within about 2 weeks or so, most patients will be back doing things that they were doing before. Well, it's going to be very different. It's going to be radically different than anything that anyone has ever done with osteoarthritis of the thumb before. Now, I do point out that this treatment has been, as you well know, available for large joints, for orthopedic operations on the shoulder and on the hip, and has been shown to be very successful for the same disease, which is osteoarthritis, just in a bigger joint. And all we're doing is we're utilizing the technology that has been around for some time to use it in this particular small joint, which is the joint at the base of the thumb. Here now we can go into surgery in a one-stage procedure. We can harvest and produce stem cells that have the ability to do what stem cells do, and in our case it is to attempt to rebuild the cartilage that has been eroded because of the osteoarthritic process. We are taking effectively a blood sample, and we are spinning that blood sample down, and we're injecting the layer that we want to inject into the joint. So there is absolutely and utterly no concerns as to the safety of this treatment. We have ethical committee approval, and we have the Irish Medicines Board online for this, and everyone's in agreement this is absolutely and utterly safe. Well, I think it will be a breakthrough. I think it will be a big change in the treatment protocols for osteoarthritis of the hand. I'm very, very excited as to the potential of this treatment. We have to, of course, wait and see, and we want to make sure that when we do it, we have all of our answers answered, and we need to get the details and the results before we announce anything. But I feel that we are really going to alter the treatment of arthritis. Well, it's a wonderful opportunity. It really is. I've been an independent hand surgeon for the last 14 years, and I've never been able to offer patients with this relatively early stage of osteoarthritis anything other than conservative management and the advice to come back to me when you're in real pain. This is going to change this hugely. We're going to be able to offer patients a treatment at an early stage that will have, I believe, the long-term effect of altering their disease and stopping them getting to the stage where their disease debilitates their hands.